Welcome to a new year of Ardenwood Presents, our ongoing online webinars designed to inspire and inform. Thank you for joining us today. I'm John Mitchell and I serve as Executive Director and CEO for Ardenwood here in San Francisco. I think we can still say Happy New Year. I hope your holidays were happy ones. This is our first presentation on Medicare for Christian Scientists in 2022. During this Medicare Open Enrollment Period. As a 501c3 charitable nonprofit organization, Ardenwood is an evergreen, ever-expanding idea that supports the ministry of Christian Science nursing. It provides a place to receive skilled Christian Science nursing care and to experience healing. And it offers several kinds of outreach, including our visiting Christian Science nursing service, Christian Science nurses training, and events like this one. You are invaluable to Ardenwood because your support helps us provide the highest quality of uninterrupted services. You bring out the best in us. Now let's talk about today's webinar topic, understanding Medicare as it relates to a Christian Scientist. Medicare is complicated, but we have a team in place that can help you understand it and help you make decisions related to your individual needs. First, I just want to mention how wise it is, after being in this business for a while, how wise it is to give thought to a personal care plan in the event that a need for Christian Science nursing care arises. If you have a need, you want your focus to be on God and healing, not on excessive amounts of paperwork or how to pay for care. So clearly, thinking through your options in advance is key. So again, we're glad that you're here today. My second point is just as important. By offering these webinars, Ardenwood is not advocating for Medicare per se. It is simply one choice, a benefit that's open to you if you're 65 or over, because you have paid into Medicare with each paycheck you've received throughout your working life. You've paid for it. The funds are available for you to use if you so choose. One perception of Medicare is that it's intrusive, that it wants too much information about your physical well-being. To be clear, as you know, Ardenwood Christian Science nurses do not, or Christian Science nurses per se, do not diagnose. So Medicare receives from us only general information about you. Under federal law, Ardenwood is classified as a religious, non-medical healthcare institution. Sometimes you'll hear the acronym RINKI in these presentations, and that's what it stands for. So as a RINKI, a religious, non-medical healthcare institution, Ardenwood is a Medicare Part A provider. And from our experience, working with Medicare has proven to be much less intrusive than working through a claim with an insurance company. Here's one more important point. Being on Medicare has no effect, being on Medicare or not, I should say, has no effect whatsoever on the care you receive from our Christian Science nursing staff. It simply comes into play when you're paying your bill. As a reminder, you can ask questions using the Q&A button at the bottom of your screen today. Only we see the questions you type in. Depending upon time, we'll answer a few today and many more on Thursday during our Q&A webinar. And finally, the content shared is only informational and is not intended to be legal advice. A replay of this webinar will be available on our website tomorrow morning at ardenwood.org. Today's presentation will be given by Jim Maher, Katie Burris, and Lesleah Frisco. There is one other very helpful resource you should know about and are welcome to contact for help with anything related to Medicare. And that is the Christian Science Provider Network, or CSPN. Their contact information will appear at the very end of this webinar. Now, let me introduce Jim, Katie, and Lesleah. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He has been helping individuals and companies navigate Medicare since 1989, and he frequently speaks to law firms, CPAs, medical groups, school districts, Rotary clubs, as well as large and small companies. And just as an aside, Jim has spoken with more than 1,300 Christian Scientists since we started this over a year ago. Jim is also a certified long-term care insurance strategist. That means he specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim and his wife of 36 years, Teddy, live in Lincoln, California, just north of Sacramento. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie's a partner at McGrew and Maher Insurance Services and has been in the business for 17 years. She is licensed for life insurance, long-term care, and Medicare in several states. Katie is married to her high school sweetheart, Brian. We look forward to meeting Brian someday, Katie. They are busy with their 2 daughters and 3 dogs. Lesleah Frisco is Ardenwood's Director of Christian Science Nurses Training. Leslie graduated from the Mother Church's Christian Science Nurses Training Program and has been a journal-listed Christian Science nurse since the late 1970s. One of Leslie's previous responsibilities was to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, Leslie is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. So let's get started. Jim, Katie, and Leslie, it's all yours.
Hi, everyone. Thank you for joining us. We'll get this up. So today we really want to talk about some key Medicare enrollment dates for Christian Scientists that are happening now. A little bit about us. I know we already went over.
Right.
Jim Maher.
Hi, everybody. I'm Jim. That's Katie. And we, first off, John, thank you for the nice introduction. Hey, it's an absolute pleasure dealing with Christian Scientists. I think this is going on maybe our 3rd year or so. I've learned so much. You're kind, you're caring, and we're just going to keep educating and working with you on Medicare to make sure that everybody understands all these crazy enrollment periods and the intricacies of Medicare. So again, it's a pleasure working with all of you.
We are broker consultants who specialize in Medicare and long-term care. It's important to note we are not affiliated with Medicare, Social Security, CMS, or any other government agency. And really, our goal is to help mitigate healthcare costs in retirement. Today's agenda, we really want to talk about 2 different things that are now happening. The first one being the General Enrollment Period, and the second one being the Medicare Advantage Open Enrollment Period.
Even though we just finished a Medicare Open Enrollment Period, the one we just went through in October, really, they renamed it, calling it the actual annual election period. Not that that's confusing to anybody, but it really is. So now we have these 2 enrollment periods, and they're simultaneous. And the key one, I think, for most scientists that we've talked to is the General Enrollment Period. And we're going to go through that now, and then we'll finish up with the Medicare Advantage Open Enrollment Period also.
The General Enrollment Period, this is the time for those of you, and we've talked to a lot of you, that are in this situation where you didn't enroll in A or B when you turned 65 and or when you retired after you turned 65. Now would be the time that you could pick up A and B. It happens between now, January 1st, and March 31st each year. So you're in that time right now. And if you enroll now, you will be effective July 1st. And you can also have your supplemental plan effective July 1st as well.
One question we get all the time is, why wait until July 1st? And we still don't know the answer to that. I don't know. Government picked that date. So again, you can enroll right now. A lot of you that are receiving Social Security, if you're over 65, you have to have Part A. So the big question is, what about Part B, right? What do we do if you're a Christian Scientist debating whether should we add Part B or not? I think that's the big question here.
So we'll go over Medicare Basics again. I know we've gone over that before, but let's go over that a little bit. There are 2 parts of Medicare that are referred to as Original Medicare. And those are Part A, which is the hospital side. And it also helps if you're in a religious non-medical healthcare institution, we'll refer to as a RINKI. And then Part B would be the medical insurance side.
That's right.
So there are certain times that you can sign up for Medicare Part A and B. The first one being your initial enrollment period, and it is the 7-month window in which you turn 65. So 3 months before, the month of your 65th birthday, and 3 months after.
Right. And it's kind of interesting, you know, Medicare really is you need to enroll or you're going to be fined type system, right? It's insurance, it's government run insurance. And the way they get your attention, right, is if you don't do it correctly, they fine you. So that initial enrollment period applies to everybody. There is an exception, and that's if you're still working, you or a spouse, and you're on a company's group healthcare plan, right, with more than 20 employees. Normally, that's the key. You qualify, well, you still qualify for a special enrollment period, even under 20. But the point being that if you on a group plan, you have some protection, right? Sign up, you're going to wait till this thing called a special enrollment period.
So when you decide to retire or you quit, then the month that you lose that employee coverage through your employer, then you would have 8 months in order to pick up parts A and B.
That's right. And nobody ever waits that long, quite honestly. We've been doing this a long time. So if you're going to retire, for example, in July, we would want to start talking with you now or in the next couple months at the latest. That way we can help you ease into how to enroll for Medicare, what to expect cost-wise, things like that, which plans would be best for a Christian Scientist.
So for those of you that didn't sign up when you turned 65 or when you retired, you are subject to, again, the general enrollment period that's happening now until March 31st. So March 31st is that deadline.
Mm-hmm.
And you may be subject to a late enrollment penalty. Your coverage will be effective July 1st, and you can add the supplemental coverage July 1st. And we'll go over the penalties later in the presentation.
Right, yeah, we've got that too, but that's super important to talk with us first or prior to enrolling, because you want to get all the information and then you make an informed decision, right? You want to think about it, pray about it, make sure it's the right thing to do, and then you would pull the trigger, right? I shouldn't say pull the trigger, make the decision, honestly.
So what does Medicare cover? Part A, the hospital or Rinky side, covers Christian Scientists in a Rinky because they are certified to participate in Medicare. It's premium free if you or your spouse has worked and paid taxes for 10 years or longer, and the coverage is nationwide. So any hospital or Rinky in the entire US would be covered. Right.
And so one question I've been getting, Katie and myself, been getting from a lot of Christian Scientists are, where do we find all the Christian Science facilities? And Ardenwood has an excellent website. I was on there this weekend really looking around, and they've got them all listed on there. So I've learned Ardenwood is an excellent source for somebody like me and Katie, who are Christians, but we're still really understanding the Christian Scientists. But it's a great website, and they've got them listed in there. I went through them and saw the ones that they have on there.
So with Medicare Part A, the cost of that, if you are in a hospital or a Rinky on a Medicare approved stay, for the first 60 days, you would pay a deductible. So for 2022, that's $1,556 for the first 60 days. And then from days 61 through 90, you would then pay $389 a day. And then from days 91 to 150, it would be $778 a day.
No, that's a hefty cost, right? People don't understand that, and they're going, well, gee, if I'm paying for Medicare, why isn't it covering everything? Because Medicare, we know it's not free, and we know there are co-pays, deductibles, and co-insurance. And this is when people see this sometimes, that's the first 60 days you're going, okay, but then the second part, the $389 per day. But after that, it gets incredibly expensive. And after 150 days, right, you can only use that 91, those lifetime reserve days. That's for your lifetime, right, Katie? You can't just say every time I go in there, I'm going to have access to that.
So that would be the days 91 through 150.
Right, okay.
Anything we're missing on that, Leslie?
I just want to jump in. I mean, obviously we expect quick and whole healing. So it's not a given that when you come in that you will be needing to be covered for 60 days or 90 days or 150 days. But the individual needs to have a care need, that is skilled care need, that would continue to qualify for Medicare.
Right.
So as one progresses, they may still need some care, but it may not be at Medicare level. So that's just something to consider, not to have that expectation that you've got this free ride, because we are going for healing and getting back to life.
Yeah.
Correct. So the cost. So let's talk about what the actual cost would be on if you were in there for 150 days and it still is a Medicare approved stay.
Right.
So for the days 1 through 50 is that $1,556, and days 61 through 90 at $389 a day, you're talking an additional $11,670. And then days 91 through 150 being the $778 per day, you would be looking at an additional $46,680, and that drops you right about $60,000.
Right. And so we're going to show you an alternative, right, with using some type of a supplemental plan that would help take care of those costs for you. We're going to talk about, but that is reality. If you don't have some type of supplemental and you just have original Medicare, and that does happen to you. I think we got those numbers from Nancy last time, Leslie, and we just updated them for 2022.
So on the Part B, the medical insurance side, there is a monthly premium for that. So that's the reason that some Christian Scientists have not picked up Part B previously. It is adjusted for income. So they call it an income related monthly adjustment amount. IRMA is what it's referred to shorthand. The premium on that ranges anywhere from $170.10 a month for the base premium up to $578.30 if you are subject to an IRMA.
That's right. The government likes higher earners. So that's what they're doing. It's an additional tax for higher earners. And should we tell them how it's kind of calculated? Let's talk. So what they do is every year, they do a 2-year look back. So for 2022, they're going to be looking at your 2020 income, and they look at your modified adjusted gross income, not your AGI, but your modified adjusted gross income. So if you have things that aren't super common, like, well, tax-free muni bonds, government bonds, foreign income, things like that, they bring that back into the calculation to actually bump you up, right? They don't adjust it, they modify it up. We have that on our website, or you can always email us and we can send you that new grid. It's real simple, but they do. So every year, so next year, right, for 2023, they're going to be looking at your 2020 tax return. Not that they don't trust you, right, but they work in conjunction. You have Medicare, Social Security, and you also have Department of Treasury or the IRS. So they look at your return and charge you accordingly. But there are ways, without getting too far down the rabbit hole on the IRMA, there are ways to alleviate that now. For example, if you retired and you no longer have your salary, right? A life-changing event, if someone passes away, if your spouse passes away, there's things like that. And you can always call us and say, hey, can you tell us how that works again in my situation? And we're happy to send you or email you that information.
One other thing, that premium, that $170.10, they're looking at possibly adjusting that before the end of the year. So they had a rather large increase this year to the Medicare Part B premiums. Half of that cost was based on a drug that the price was actually reduced on. So they're looking at adjusting that. If that happens, we'll make sure that we start talking.
So that is good news, right? They're actually looking at doing something now, hopefully. Katie was talking about this new drug that they're introducing called Aduhelm. It's supposed to help, and most Christian Scientists probably aren't dealing with it, but in the non-Christian Science world, we see that a lot with Alzheimer's. Well, this was supposed to be a drug they brought to market, and it's very reasonable cost, only $56,000. So they went and did their math and said there's going to be a couple million people in Medicare eligible, and it's going to be covered under Part B as in boy, not D as in drugs, but B as in boy. So that's why they built that into the premium this year. Instead of $148.50 going up to, they were thinking $158, $159. They raised it to $170.10, which is That's incredible. That impacts so many people. So they're actually looking at doing something now and hopefully pulling it back into that $158, $159 price range. We hope.
So stay tuned. We might have good
Yeah,
news.
hopefully.
Coverage for Medicare Part B is nationwide. Again, you have to stay within the US to have the coverage. And it includes any provider that accepts Medicare.
And I'm going to add territories too, because we've had,
Thank you.
if you're in Puerto Rico, any of the US territories too, Medicare is accepted there also.
There is the premium penalty for the late enrollment. So for every 12 months that you should have had Part B and didn't, there is a 10% penalty. So that 10% is based on that 170/10. So keep that in mind.
Right, because when we're looking at adding Part B on, so it's real simple math. It's what's 10%, $170. I'm sorry, $17.01, right? $17.01 a month. So if I've missed 10 of those periods, basically I'm paying that whole premium again, right? $170.10. If I missed half that, right? You just multiply 5 years times $17.01, and they would add that onto your monthly premium every month for the rest of your life, right? I mean, it's an unforgiving penalty. That's why we want to make sure that Christian Scientists understand that if you do add Part B and you haven't done it for a couple of years, you probably will have some type of penalty.
And if you're thinking that you're going to sign up for Medicare A or B or just even B during this general enrollment period, always feel free to give us a call because we can talk through. That penalty might not be as much as you think if after 65 you worked for a while.
Right,
so
that's true.
There's some things to factor in there when you're considering that.
That's a really good point, Katie, because we have had quite a few that were working 67, 68, 69 and coming off the group plan. You would not be fined for that period of time because you're on a group health plan. So that is the good news.
It will require a little bit of legwork, but we can talk through that.
Right.
So Medicare Part B, we went through and highlighted in red the most common things for Christian Scientists. So on that Part B side of the medical insurance side, so if you needed like an x-ray, a bone set, if for some reason you're somewhere and you pass out or something like that, then the ambulance or emergency room services are also under Part B.
It's super important. You know what, Leslie, I think we should probably talk about the Advanced Healthcare Directive here, right? I think
Yes.
John's even used the example of something happens to me and I don't have any say and they take me. I think his example was San Francisco General. Can you kind of take us through that and what a healthcare directive would do for a Christian Scientist?
Sure. Well, first I'll identify what a healthcare directive is, Advanced Healthcare Directive. It's you are putting your affairs in order by having this legal document that authorizes someone to speak on your behalf if you are ever not able to speak on your own behalf. So if a situation comes where you're maybe in a public setting and you pass out and someone calls 911 because it's their obligation to do that, and you wake up in San Francisco General or wherever, getting out sometimes can be difficult. So having a document where someone can come and say, I know what their wishes are, and I know that they would prefer to have Christian Science nursing care, and then arranged for them to be transferred to a Christian Science nursing facility. That has happened many times. We've also had situations where it's taken more than a week to get someone out of a hospital where they never intended to be there to begin with, but kindly neighbors had called 911, and the hospital was not willing to release them because they felt they were very responsible and that this individual perhaps wasn't making rational decisions. So once that Advanced Healthcare Directive was in place, then they very easily released him to come to the nearby facility. So it's so important to have it, to identify, it could be a family member, it could be maybe you have family members that are not supportive of your choice of care as a Christian Scientist. Let them know that you do have this document in place and have someone that will honor your wishes. And it gives them the authority to make that decision, even over a family member who may have different thoughts. So it's a great protection. Any medical facility that you may end up in, any place that provides Medicare coverage they legally have to ask you if you have an advanced healthcare directive in place, and they will honor that. So where do you find the advanced healthcare directive?
I was just going to ask, that's the best place to go.
We have, Ardenwood does have one on our website, and it has been vetted by attorneys in California that are Christian Scientists. It does have language for Christian Scientists. It gives you options. You can choose to include very specific details. You can put lines through part of it you don't agree with, very much customize it. You could take that document into another state, modify it, have it reviewed by a local attorney, and then have it in place, and it would be honored there. And then where do you keep it once you have it? Don't just file it away where no one knows where it is. You might scan it or take a picture of it, even have it in your cell phone so it's readily available. You might have a card in your wallet that says, this is my agent, this who you should contact in the event of an emergency. Have that person have a copy of your advanced healthcare directive with them. Let family members, friends know where it is. You can also, maybe you have a senior relative that's living alone, put it on their refrigerator, because if there's a fall in the garden and the neighbors call 911 or something, the first responders will know to look on the refrigerator door. That is just an automatic place they go to look for things like this. So it's such a protection.
Yeah, thank you, Leslie. It really is, right? And I think that's, and it's on the website. Again, great website, and you've got the form on there.
So the Medicare Part B, so once you have that in place, if you need services, there is a deductible on that. So for 2022, the deductible is $233. And then once you were to hit that, you would then be responsible for 20%. But the problem with that is there's no cap on that 20%.
That's right. That's a big number. I've used the example before. I had my knee, the meniscus in my knee kind of went out, so I had to have it surgically repaired. And it would be covered under Part B of Medicare. It's outpatient surgery, and it was 8 hours, a $67,000 bill for 8 hours, which would be covered under Part B. Well, even if they say, listen, Medicare gives you a discount, you're only going to pay $50,000. Still, 20% of $50,000 is $10,000. That's a big check to write out when you don't have to. And the thing, it's not per occurrence, it's per calendar year. So if I went in again, if I had the other knee or something else happened to me, again, there's no cap. I'm going to pay that 20%. So we're going to show you how to limit that cost also as a Christian Scientist.
And that Part B deductible, that $233, you have to meet that one time per year. So that's not a per occurrence, but that 20%, that continues on
That's
for
right.
any occurrence.
Yep.
So Medicare doesn't cover everything. Original Medicare does not cover all of your costs of care. So we've gone over the out-of-pocket costs and that no cap on the Part B side. They don't cover prescription drugs, dental, vision, hearing, eyeglasses, contacts, hearing aids.
And they don't cover long-term care or custodial care. Those are most of the calls we're getting. It's still weekly. It's amazing. We're still getting them, but long-term care, right, is not covered by Medicare or custodial type care. So if one's they've healed, right, Leslie, they've healed, now they go home, maybe they need some practical care, right, with bathing, eating, dressing, things like that. Medicare says we don't cover that. That's custodial type care, and that's not covered by Medicare.
And then also care received outside the US is not covered.
Which includes Canada and Mexico, the two most asked questions I get when we say the United States or its territories. What about Canada or Mexico?
No.
No. So.
Now, what about additional coverage? So once you have A and B, you now have the option of insurance. So what we see most common is that Christian Scientists pick up a Medicare Supplement or a Medigap plan, and then it's an individual decision as far as the prescription drug plan.
Right, and Medicare Supplement and Medigap mean the exact same thing. They just use, a different term. But the important thing too is that we understand with Christian Scientists that prescription drugs, right, is an option, the Part D plan. So most Christian Scientists, you're incredibly fortunate you're not taking any prescriptions. So if you don't start it, right, there's no fine. We'll talk about that in a minute too, and about this other enrollment period.
So with the Medicare Supplement or the Medigap plan, it helps cover those costs that aren't covered by Medicare, the costs that we went over before. The plans are offered by private insurance companies in each state. They help limit your costs. You must be enrolled in A and B, and then it's nationwide coverage.
Right. So there is no network. People always go, well, I want to get a PPO or something like that. Original Medicare is better than a PPO because it's accepted by any provider that takes Medicare, any doctor, any facility, any lab, right? Wherever
Any
you're
rinky.
traveling, and so that's important. And Leslie, we really don't talk about insurance companies here, but I know Nancy, before we talked about, one of my favorites is the United Healthcare Plan. I really like them. They're endorsed by AARP, but they pay quickly and well. So I know providers like them. I think Nancy told me they've had some good experiences with them there at Ardenwood.
Yeah. And one thing I might add is that where you've talked about the length of time that Medicare covers, a Medicare supplemental will continue beyond that if there still is a skilled care need. Could be up to a year of coverage.
Mhm.
So
Big
it's,
deal.
yeah, because once Medicare is up, it is full pay, full private pay.
Yeah.
So to have
Yeah.
that supplemental plan in place, and of course, no one expects they're ever going to need it, but to have that ready, you're covered if you need it.
Right.
These plans are also what they refer to as guaranteed renewable, meaning if you have a claim, they can't cancel you as long as you continue to pay the premium.
Right.
The plans are standardized in most states.
Right. And we're just going to say with most states, there's a few exceptions, Massachusetts and is it
There's a few
Minnesota? There's a couple
exceptions.
exceptions, but for most everybody out there, these are the standardized plans. And we want you to pay attention. We really like Plan G like George. And we're going to give you an example of that in a minute, but it's very affordable, right? It's not super expensive. It's affordable, but we're going to show you what it does to you if you are in a rinky for a period of time. And like Leslie says, these will pay up to a year as long as it's a Medicare approved stay.
So most individuals that are aging in or that are turning 65, I've seen anywhere between like 125 to like 160 is kind of
Right.
like the standard monthly rate.
That's pretty close, right? Depends on your zip code. They're all zip code rated or county rated throughout the United States.
So if you have Medicare Part A and you have that supplement plan G, then here's what happens. If you're on a Medicare approved stay in Ardenwood or another rinky, you would have a $0 copay for up to 365 days.
Right. So that zero is a big deal, right? Zero is your hero because like Katie said, these plans are incredibly affordable to know that if you're paying a small premium like that, that you don't have to worry about anything if you're going into Ardenwood or if you're outside, if you're going into another hospital that accepts Medicare, which in the non-Christian Science community, most every hospital out there accepts Medicare across the United States. It's
And
hard
Leslie,
to find one that doesn't.
Leslie brought up a really important point. When we're talking about a stay, in a rinky, and once you hit that 90 days, that 91 through 150, that extra 60 days, that's a lifetime. So if you use that, let's say this year, you were in there 150 or more days, then next year or years from now, if you need care again, you have up to the 90 days.
The 90
That's
days,
it.
right.
You don't have more days, but on the supplement, you continue to have the up to 365 days.
Which is a big deal, right? Your focus is on getting better and spiritual healing, and knowing that in the back of your mind it's zero. That's comforting also.
So on the Part B side, if you have a Medicare Supplement Plan G, once you hit that $233 deductible, that other 20% goes away and the insurance company covers the costs associated with that.
Again, you're covered in full, whatever Medicare approves, right after that deductible. Because people always tell me, well, gee, I want that free Medicare and 100% coverage. And that's not how original Medicare works. Like Katie said, If I know right now for the rest of the year, my liability is $233. So if I'm a Christian Scientist and I do have a fall, I'm taken by an ambulance somewhere to San Francisco. We just keep saying San Francisco General because that's the example we've been using. It could be any hospital. And I need I've got care there. I get out, I may need some durable medical equipment, a wheelchair, things like that. That's all covered under Part B of Medicare. But to know that you're covered after $233, you're covered in full for anything else Medicare approves for the rest of the year.
It's some good peace of mind.
It's a big peace of mind, actually.
So Part D is the Medicare prescription drug coverage. It helps with the cost of prescription drugs. It is optional. You may be subject to a penalty, but only if you purchase it later. If you decide to never enroll in a prescription drug cost, that penalty does not apply to you.
You don't have to worry about it, correct?
The plans are offered by private insurance companies, and there's really two ways to get the coverage. So you can have just a Part D prescription drug coverage if you wanted to put that with your supplement. The other way is a Medicare Advantage or an HMO usually type plan. A lot of those include prescription drug coverage, and a lot of Christian Scientists don't realize that until they have a late enrollment penalty.
That's right. We're going to talk about that in a minute here, that other, the Medicare Advantage open enrollment period here. But we totally understand that Christian Scientists, if you're not taking prescriptions normally, if I'm speaking to non-Christian Scientists, I would absolutely advise to get a Part D drug. If not, they're going to fine you at some point, right? And it's 1%. The national average is like 33 cents a month. But if you've done that for 5 or 10 years, that really adds up. So if I've done it for 10 years, that's 120 months times 33 cents. So you're probably $39, $40 a month just in the fine itself. But for Christian Scientists, we understand that it's a personal decision. And as long as you don't sign up for it, there's not going to be a fine. Mm-hmm. Correct, Katie?
Mm-hmm. And again, we could always go over your specific case if you have questions on that.
Now we're going to talk about the Medicare Advantage open enrollment period, and yet another acronym, MAOEP. Really what this pertains to, and the reason we want to talk about that, a lot of Christian Scientists we've talked to throughout the year had signed up or had been signed up for these Medicare Advantage plans. It's the one that you see on TV with Joe Namath and Tom Selleck telling you, hey, you should get these plans because they're free or the government's going to give you money to sign up for these plans. Here's the deal. They really do. You have a very low cost premium, right? Usually they can be zero. We don't see anything really much higher than $30 or $40. In California, they're usually in the $20, $25 range. But it's an easy way to sell somebody saying, if you don't have a supplemental plan, gee, you're a Christian Scientist, you should get this. It doesn't cost anything and it covers you, right? If something happens to you under Part A or Part B, it's got to be as good as that. And you can talk about, it's normally an HMO or a PPO organization. But here's the key, and we've talked several times with Rogers and with Lesleah and Nancy, we know it's not Christian Science friendly. It's a hassle for Christian Science facilities to get paid from the insurance companies. I know it's, Nancy said sometimes it's can be a year to 2 years, right, to try and get paid from these insurance companies. But here's the problem, Kate, of what we've seen. Most of these plans have Part D built in, right? It's built into the plan itself. And if I haven't been on Medicare, let's say, just a quick example, let's say I'm 70 and I was eligible when I was 65 and I just purchased one of these plans. And all of a sudden I get a bill from the government saying, gee, Jim, you now owe us this penalty for Part D. And I'm going, well, I didn't sign up for Part D. And the government's saying, oh, yeah, you did, because it's included in this Medicare Advantage plan. The one Joe Namath is advertising, it's included in there. And because I haven't had a Part D penalty previously and I signed up, right, in a Part D plan, I'm not going to pay the penalty. So this is the time you can do something about that during this open enrollment period. It allows you to actually get out of your Medicare Advantage plan if you want to. Right? So if you get out of that plan, you're still going to go back. You're going to have original Medicare, but the penalty goes away. Because if you decide I want to go back to original Medicare and get some type of a supplement plan, that Part D penalty, you're not going to sign up for another Part D penalty. I love this, what Katie did right here, right? So you've gone from Medicare Advantage to original Medicare, you get rid of the Part D, there's no penalty anymore. The penalty stops.
So you can also apply for a Medicare Supplement plan. So we would kind of do this in reverse, and we could talk to you on your specific case. But a lot of times is what we do is we go through what the Medicare Supplement plan is going to cost, what the requirements are to apply for the coverage, because you have to answer some health questions, and we would go over those with you. And then we can help you with the application process. And if you're approved, then we cancel your Medicare Advantage plan. So we want to make sure that you don't just cancel that right away.
Yeah, that's a
and
good
then
point.
call us beforehand, and let's walk through this process.
That's exactly right. And it's simultaneous, right? This period happens to run the same as a general enrollment period. So it also runs from January 1st to March 31st. But it's important to act now. You don't want to wait and call us in April, May, or June and say, I think I want to move, because you can't, right? You're kind of stuck on that if you decide you want to come back to original Medicare. So again, the whole process isn't that difficult. It starts with making sure you can get the supplemental plan. And from dealing with Christian Scientists for the last few years, I don't think we've had anybody ever answer yes to a health question. You're incredibly blessed with good health, that's for sure. Most non-Christian Scientists can't, I can't say that.
The thing to keep in mind, just so we kind of clarify things a little bit, although this has that same standard period of January 1st through March 31st, if you were to call our office, let's say this week, and you're interested in looking at moving to a supplement and dropping your Advantage plan, we can pick that up for February 1st or March 1st. Or even April 1st,
right?
It wouldn't wait until July 1st, like with the general enrollment period.
That is confusing. You're right.
So
no,
confusing.
But Katie's right. So again, if you want to get off one of the HMO, the restrictive plans, and go back to original Medicare, right, where it's more Rinky friendly and you can go to any provider in the United States that takes Medicare, now's the time to do it.
Jim, one of the challenges that I've seen over the years is that people don't know that they are in a Medicare Advantage plan. They say, well, I still have my Medicare card, but then
That's
it's, what's that other card?
Here,
And you mentioned United Healthcare, for example. They have both a Medicare
Right.
Advantage plan and a supplemental plan, and they are completely different. So if you don't know what you have, call Jim.
Well,
Katie,
yeah,
have them
or-
on
I
the
can't
phone.
tell you how many people that they've said, well, I'm not sure what I have. And I go, okay, here's what you do. Take a picture of your card, text it to me or email it to me, and we can find out exactly what you have, what you're paying, what the coverage is, so that you know. So that's something we can absolutely help with.
And Leslie, rule of thumb, if you pull that card out of your pocket, out of your wallet, out of your purse, and it's got some letters on their HMO or PPO, that's the Medicare Advantage. Anything with initials normally means you have a Medicare Advantage plan. So thank you for bringing that up. Lastly, we wanted to go through, we're still getting calls about long-term care. And I know we're going to talk again, I believe in March, we're going to review it, because people call us from all over the United States, and we try and help, whether it's with you, a loved one, a spouse, a parent, trying to even access benefits with some companies. Not that we've had anything to do with it, but we want to be able to help you, tell you how to access care and get those benefits. But I always tell people long-term care, it's really, it's a life-changing event. And I mean, I'm going through it with my mother-in-law right now. And even though she did have some planning, we had a policy for her, she decided, or her advisor decided she didn't need that any longer. And unfortunately she does now, but it changes everything. It changes my wife's lifestyle, my sister-in-law, my brother-in-law, myself. It really does. It changes everybody's lifestyle. I always tell people it's not about you, it's about the people that care and love you, right? So if you ever really need care over a period of time, your life doesn't end. Like my mother-in-law, she's like, well, this is great. Everyone's taking care of me and bringing me food and helping me bathe, things like that. But someone else's lifestyle is going to end. And that's what people have to understand. I always, especially men, I say it's not about you. It's about your family, your adult children, how it impacts their lives, right? So that's all we wanted to share today about that. The replays I know are on the Ardenwood website. You can go back and watch some of those. But there's so many options out there nowadays. We talk about leveraging your money. I think the next slide we're going to talk just briefly, this one slide. But leveraging really means, how can I turn like $1 into $3 or $4 for care? And you just put zeros after that, right? I was going to say 100,000. It's just easier to do this. So really, you're talking about transferring money to an insurance company. It's not that simple. You have to be healthy enough, which most Christian Scientists are. But you can immediately increase your assets. I look at some people, we've taken $100,000. I'm just using that as an example. That's not something you have to put in, but I've seen 100,000 turn into 300,000 immediately, right away, that you use for care. And people go, well, what about that $100,000? And I still, well, you still have that asset, right? It's not like you're taking out of your left pocket, putting in your right pocket. You still have that, but now you have 3 or 4 times that amount for long-term care. One thing I really want to stress too is, I've done this for 33 years, and I see all the time, especially talking to other brokers or financial advisors about self-funding. Well, just use that money that you've set aside, use that for your care. And I really think there's a better way with these asset-based plans we talked about in the past, where you can turn that into 3 or 4 times for care. For example, we talk about Nationwide, a company we really like, where I know in California, after 5 or 6 years, if you want to cash out, you can get all your money back. But in the meantime, you've leveraged, you said, if I do need care, I may turn 100,000 into $300,000 or $400,000 for long-term care, which takes the burden from my adult children, from my sister, from my brother-in-law, whoever it is. And you still maintain control of that asset, right? If I cash it out, you're just kind of saying, leverage means I'm getting more for something. If people, there's no free lunch, right? There's always a cost to it, but essentially you still have more in long-term care benefit, Katie.
We've had a lot of people that we've talked to where maybe their financial advisor said, well, why don't we take 100,000 and we'll set that aside if you need care. And so we've talked to them and said, okay, well, you're setting aside, that is set aside if you need care anyways. Well, let's take that and give that to an insurance company and then just increase the money you have if you need care.
Right.
Or like Jim said, in a few years, if you decide you don't want it anymore, you can cancel it and get most or all of your money back. Or if you pass away and don't need the care, then the money goes to your beneficiaries. So you don't have to worry about losing that money.
That's exactly right. There's more money left for not only your children, but for your favorite charity, your favorite Christian Science charity, like Ardenwood or whoever it may be. But the reason I put that one up there, I had Katie put this bullet point in, your investment person will not be happy. I've been doing this a long time, and even with Christian Scientists, most everybody they want to say a guy or a gal, right? That do I have a person that takes care of my finances? Let me check with them. I always say, well, I can tell you what they're going to probably advise in advance, that you've got enough assets. It's just a different way to fund, right? Instead of self-funding yourself, self-fund with the insurance company, turn that money into 3 or 4 times that amount, take care of your adult children so they don't have to worry about you or where that asset's going, and leave more to the church, quite honestly. I mean, the mother church, every 501c3 organization like Ardenwood, anything you can help, I know is going to be a big relief to not only your family, but to charities also. The last thing I'm going to talk about, my mother-in-law, because that was a pet peeve of mine. Her investment advisor told her to self-fund, that she had enough monies, right? Until she ran out of her monies and no longer had her long-term care policy, which now means that we are supporting her. And there's nothing wrong with that. We love my mother-in-law. She's an awesome person, but still it's changed our lifestyles, all because she listened to her advisor, informing her of, you don't need to do that, you'll be taken care of. And unfortunately, that didn't happen.
The most important thing that you need to know from today is that you can always call or email Jim or myself. I'm Katie, and we are here to help. There is no charge to work with us. So if you place business with us, you write a Medicare Supplement, a long-term care plan, we're paid by the insurance company.
That's correct.
So we don't charge you. Even if you call us and you have some questions, we are happy to look at what you currently have and let you know. And then you can always refer to our website as well. And that's www.whatsmedicare.com.
Right.
And with that, we are done.
I think, do we have some questions, John?
Yes, we've got just a couple questions here, and we'll have many more on Thursday. The first question is, and by the way, excellent job. I've heard these for a while and I learned something new every single time. So thank you, all three of you. First question up, should a Christian Scientist find themselves in a medical facility where drugs might be administered? Should Medicare Part D be part of their plan? Or can they be covered under Parts A and B?
Leslie, I'll jump in, then you can finish up. Right, if you go inpatient in a regular facility, non-Christian Science facility like San Francisco General, for example, you're going to be covered under Part A of Medicare if you're admitted, or Part B, and that's where the drugs are going to come from through the hospital side. If you're administered drugs, normally through Part A.
So
Great.
if they didn't have Part D, then that wouldn't matter in this case?
No, because you can't use your Part D prescriptions in the hospital if you're inpatient.
There
Or
you
an
go.
emergency room.
Right, that would be under Part A or Part B of Medicare.
Okay. And you can't use any drugs in a Christian Science nursing facility. So
Okay.
that's, yeah.
That's a great question, though. That's really a good
That's a
question.
great
We
question.
should have brought that
That's
up.
good too.
So,
Next up, as a military retiree, I will sign up for Tricare when I lose the medical coverage provided by my current civilian employer, where I will have worked from age 45 to 71. My civilian employer is a Christian Science institution which provides coverage meeting the requirement for Medicare Part B, but does not cover prescription drugs. So I would have to pay a penalty to sign up for Medicare Part D. Tricare replaces Medicare Supplement plans for military retirees and includes prescriptions. It's just
right,
a
normally,
statement, yeah.
Mhm.
yeah, that I think that's more of a statement, right? Same with the VA benefits. If it's a VA benefit, also the prescription drugs are covered through the VA.
Yep.
So, yeah.
This is a follow-up. Will I need to pay a penalty on my Tricare fees?
No,
Probably not. It depends on the size of that employer. So if that employer is more
Right.
than 20 and then they pick up A and B when they retire, they shouldn't have to. No.
Right. Normally, Tricare says to get Part A and B of Medicare, John.
Mhm.
Okay.
And Tricare can be used in a Christian Science nursing facility as
Oh,
well.
There you go.
perfect. Okay.
Perfect.
Thank you, Leslie.
We've had a number of Tricare
Tricare for life.
patients. Absolutely. It's an excellent program. And well-deserved by our
Absolutely, John.
Absolutely.
Absolutely well deserved. Yeah.
Next up, and Jim, this always comes up. This should be a perennial question, and a good question it is. Would you compare Plan F as in Frank to Plan F-HD?
Oh, that's so there's HD means high deductible, not high def, which Katie and myself ran. But, so that would be a high deductible plan. So essentially, John, Plan F says, listen, if you have Plan F out there, whatever Medicare approves, the supplemental plan pays, whether it's inpatient or whether it's under Part B, you have 100% coverage. If you have a high deductible plan, I can't remember the amount this year, it's around $2,400. Then you'd be responsible for the first $2,400, then Plan F would pay everything. But quite honestly, I don't know if I'm a big fan of those. People get confused and they go, well, I'm paying a lesser amount every month for my premium. But when something happens, you get a call right away and say, why did you sell mom or dad that high deductible plan? It doesn't cover anything, right? So I've heard that quite a bit. So you have to be careful out there, right? You get what you pay for. I think you're quite honestly better off, even as a Christian Scientist, maybe looking at a Plan G without that high deductible part, because it always happens without fail. Somebody goes into a facility with a high deductible, and we're the first to get a call saying, how much does mom or dad or does my spouse have to pay? Because you sold them that policy with that high deductible plan, right? You get that.
Right. Absolutely. You don't want those calls.
No, not at all.
I tell them to call Jim with those
No,
calls.
Right, exactly. Yeah, please. Yeah. Hold on one second, please. Yeah. Next up, can you expand, please, on Medicare Supplement Plan G, as in George? You did talk about it. Can you expand a little bit on it once again?
So Medicare Supplement Plan G helps cover those costs that Medicare doesn't. So when we talk about having just A and B, so On that Part A, if you go into a Rinky, you have that deductible and then that per day cost after you hit day 61. With the supplement, that comes in and helps cover those costs.
Right.
So then all those costs become zero as long as it's a Medicare approved stay. And then on Part B, the medical side, if you needed to go to an emergency room or a bone set, x-ray, something like that, you would have that Part B deductible. You still have to pay, but everything over that, then the supplement plan G, like George, is going to cover.
Right.
Great. Well, we've pretty much come up to the end of the hour here, and I don't have any more questions to share at this time. We will have a number of questions from experience on Thursday. Once again, everyone can certainly see the replay of this tomorrow. So Jim, Katie, Leslie, thank you for guiding us through Medicare in relation to Christian Scientists. This is not easy, but it's you've explained it beautifully. Please don't hesitate to call any of these three with Medicare or insurance-related questions at any time. They are all happy to help, as is the Christian Science Provider Network, and will provide information at the end as we conclude here. So stay tuned for a moment afterwards. As a reminder, this Thursday, we will have a Q&A session on Medicare. A reminder email with the Zoom link will be sent to you tomorrow. And a replay of this webinar, as just stated, will be available on our website tomorrow. So thank you again for joining us today. See you Thursday, and goodbye for now.
All right, bye, everybody.
Bye.